morning, students. This is your Mohan Rao, Zoology Senior Faculty. Right. The STDs are get transmitted by the fungus. So as of now, we studied the bacterial STDs as well as the viral STDs. Now it is turn to here discuss about STDs caused by the fungus. Generally, a fungus that causes STD here is nothing but a yeast. And the name of the here yeast and the causative here are organism, and name of the disease is candidiasis. Candidiasis is the name of a disease caused by the fungus, which is a here yeast. Let us see here in detail the information related to this. Right. Candidiasis is the name of the disease. Causative fungal organism. Name of the here, the yeast or fungal is Candida albicans. Candida albicans is the name of the yeast which belongs to the group that is a fungi. You might have happened to heard about a term that is white discharge, which is very commonly experienced by the women. And during that here the problem, generally the women here discharge white cheesy here fluid from their genital tract, and sometimes it gives here a bad smell also, foul smell. So this is nothing but here this candidiasis, and this is get transmitted by the sexual contact. It's very common. The symptoms of this one here: painful inflammation of vagina. Inflammation means swelling. Inflammation, it includes swelling, and that too here they will experience the pain in a vagina is one thing. Here thick cheesy discharge will be taken place. Thick cheesy discharge will be taken place from the vagina whenever they are suffering from this infection. And that is the reason why here very commonly we call it as here with the name of a white discharge. You know, albican, this technical term, dictionary meaning white. Right, coming to here, this is in case of women. This kind of here experience will take place in a women. Then what about a man? Which kind of here symptoms will be developed by a male or a man? He develops also a painful inflammation here in his urethra. Urethra is a passage you can find out in a male reproductive system through which the urine it forms, it passes, through which even the sperm also it passes through during the ejaculation time. So he will here experience the inflammation in his urethra, and meanwhile he will experience even the pain when he is suffered from this fungal infection known as here candidiasis caused by the fungus known as Candida albicans. And thereafter, what is the treatment for this? Certain kind of here antibiotics are there. Let us see here the names of these antibiotics that we use for treating this candidiasis. One is here clotriazole. Clotriazole is an antibiotic. Thereafter here miconazole. Here miconazole is another here antibiotic. Thereafter here Neistia. Neistia is one more antibiotic. By using these three types of antibiotics, we can treat to this disease, that is candidiasis, one of the fungal infection. Let us here see one more here disease caused by the pathogen, that is Chlamydia. You might not heard about this word under the microorganisms groups earlier. The Chlamydia is one thing. Chlamydia is also a kind of bacteria. Chlamydia, it has got a separate genus name. It is a kind of bacteria. It causes a disease known as chlamydiasis. Chlamydiasis is the name of the disease that is caused by here an organism known as Chlamydia. Let us see more detailed information regarding this Chlamydiasis. As you know that here, a Chlamydiasis is the name of a disease and constitutive organism, here it is, an important thing. Chlamydia trachomatis. Chlamydia trachomatis is the scientific name of this organism that causes this disease in us. Right. Then how does it move or how does it get transmitted is one important thing, only the sexual contact. So this generally here get transmitted by this method. Then the incubation period of this one, soon after it enter in our body, immediately we do not develop the symptoms or the disease will not be appeared. After 1 week of the entry of the pathogen, only you do get a disease. And here, what the symptoms will be developed in this case? Here, it causes urethritis. You please observe all these technical terms in a detailed way. Urethritis. Before I explain the things, I would like to give you the meaning of this here word itis. Itis is a term actually we use as a suffix to some other here words, so that it indicates here its nature. The technical or dictionary meaning of this itis is inflammation. Inflammation here means itis medically. If this itis is added as a suffix to a certain organ, it indicates the inflammation or swelling of a particular organ. Now let us see the terms. Here it is urethritis. So you know very well about urethra. Now this condition, disease is known as urethritis. What does that mean then? Here it means that the urethra inflammation will be taking place. So urethra of the male genital tract or female genital tract will be inflamed. This is one condition. Whereas coming to the second one is epididymitis. You are all very familiar with here epididymis. In your male reproductive system, there we do here study about epididymis. This is the testes. Then this part of the testes is known as epididymis. So swelling of the epididymis also will be taken. So this condition is known as epididymitis. And here the point to be noted here it is, epididymis is present only at one side of the testes. Either side it is not possible. So this testis is present in the scrotum. So since this epididymis is getting infected and swelling is taking place within that, so you can see that unilateral scrotal pain, single, lateral, side, scrotal, the scrotum in which the testis and epididymis is present. So the person who is suffering from chlamydiasis will develop epididymitis. The symptom of this one, he will experience pain at a single side of the scrotum only. This is an important part. Thereafter here, tenderness, feeling sensitivity towards the pain. Thereafter, swelling also can be happen to see. So this is one more thing. Thereafter, mucopurulent. You know, mucot includes the mucus and it consists of even the pus also. The yellow colored here mucus and pus also will be released from the infected parts. From the infected parts you can find out here discharge of yellowish mucus with the pus, and that condition is known as mucopurulent condition. Thereafter here cervicitis or cervicitis. So this is here present only in the female because cervix is a part of female reproductive system. inflammation in the cervix will be here, happen to see. Thereafter, inflammation of fallopian tubes. Even the fallopian tubes also, the parts of the female reproductive system. Inflammation in the fallopian tube, inflammation in the cervix will be noticed. Thereafter, proctitis is another here symptom will be get developed. In this case, rectal pain is noticed. Then what does it mean? Rectum is a part of your digestive system. If you take the large intestine or colon, at its end it has got a rectum that followed by the anus. So the pain you can experience in the rectum of your digestive system also whenever a person is suffering from is chlamydiasis is one. So these are all here the symptoms of the chlamydiasis that is caused by here Chlamydia trachomatis is the name of the causative organism. Right, coming to the diagnosis and the treatment of this disease, let us see here. Gram staining is one method. I explained earlier. We do identify whether it is which kind of organism, and this gram staining can be done based on the discharges of an infected person, and thereafter antigen detection. Antigen detection also helpful to us, and meanwhile nucleic acid hybridization. A nucleic acid hybridization is also available, like DNA hybridization. Thereafter gram staining and antigen detection tests. With all these here three tests, we can detect the disease. Like here chlamydiasis. Then what is the treatment for this? So as usual, different types of antibiotics are used, and these types of antibiotics includes one is tetracycline is an antibiotic. Thereafter erythromycin is an antibiotic. Thereafter here rifampicin. Here rifampicin is one more antibiotic. So by making use of these three different types of antibiotics, we can give a permanent cure for this chlamydiasis. So this is a disease caused by chlamydia. Now let us see here the another type of disease caused by a protozoa, a protozoan disease. So we will see now. And the protozoan disease is here trichomoniasis. Trichomoniasis here is the name of the disease caused by a protozoa, and we will see more detailed information regarding this one. The name of the disease is trichomoniasis, whereas the causative organism here it is Trichomonas vaginalis. Trichomonas vaginalis is the causative organism, and here you need to keep it in mind. And this organism is a protozoa. Then the mode of transmission, it includes sexual contact. As you all know that here it gets transmitted through the unprotected sex. Thereafter the symptoms related to this one is vaginitis. You keep it in the mind, since the itis is added to the vagina, it includes that inflammation of the vagina is one important thing. Thereafter the foul smell, here a bad smell giving yellow colored vaginal discharges will be taken place. So here it gives a bad smell, foul smell, and that is in a yellow color, and vaginal discharges will be taken place, and they will experience the burning sensation in the vagina. In the vagina, burning sensation also noticed. So these are all the symptoms of the disease, that is trichomoniasis. Then here the diagnosis method. How can you diagnose this disease? Here one is the clinical symptoms, all the above mentioned symptoms that helps to us for diagnosis of this disease. Thereafter microscopic examination. Here I explained what is microscopic examination. thereafter culture of the pathogen that helps to us. But here the point that you need to here observe it carefully, that is immunofluorescent antibody staining. This is a new test that come across, immunofluorescent, and here might be heard about fluorescent bulbs, and here the point here is immunofluorescent. In this case, immunofluorescent dyes are used. These dyes actually here helps for marking the antigen and antibodies. And by marking that antigen and antibodies, we can come to know here what kind of antigen and antibodies are there, so that here we can identify this here the disease, or we can diagnose the disease trichomoniasis. So that type of test is known as immunofluorescent antibody staining. In this immunofluorescent, fluorescent here drugs are used, dyes are used, fluorescent dyes are used in order to mark the antigen and antibodies. Then the type of here antibiotic that we use in order to treat that disease is metronidazole. Metronidazole is an antibiotic that is here helpful to us to treat this protozoan disease known as trichomoniasis. So, and this is all about here the protozoan disease. Right. So with this we do study the very important diseases comes under sexually transmitted disease caused by the various types of pathogens. So as of now, the bacterial diseases, viral diseases, protozoan diseases, fungal diseases, chlamydia diseases, and we do study about all of them in a detailed way. Thereafter here, and the treatment for that, symptoms for all the diseases, and thereafter the mode of transmission, about all the things. As of now, we studied in a detailed way. Now let us see here, as an old age proverb, even the prevention is better than the cure. Even yesterday I explained about all these things in a detail, so that so I have to remind the points again here. So prevention, what is the prevention method for all these diseases? One is avoid sex with unknown partner as well as multiple partners. And thereafter, one should always use condoms during the sexual intercourse. So the condoms not only act like a barrier, even they protect us from the sexually transmitted diseases. Thereafter, a person here, if at all he get a doubt that he has got a sexually transmitted disease, immediately he must consult with a doctor. Right? Then he should get a complete treatment for his sexually transmitted disease. Once if he get a complete treatment for that, then he may not get transmit the disease to some other else. Right. And thereafter here, the confirmation test for that. As of now, I explained about variety of tests that helps to diagnose these sexually transmitted diseases. So here all this confirmation test that available to us is culture and microscopic observation with a specific strains is one important type of test that is available to us, and detection of specific antigen antibodies by using ELISA, enzyme linked immuno here sorbent assay is a test available to us. Thereafter, the another one is DNA hybridization. Like here I explained nucleic acid hybridization, nothing but DNA hybridization. Thereafter, polymerase chain reaction, PCR tests, all these tests are available to us in order to diagnose the above mentioned all the diseases. Right. Coming to the next one here is, how do we control? Is there any cure for the disease? And here the point, again I am repeating and reminding to you, one is the disease like HIV, the disease like hepatitis B, the diseases like genital herpes has no cure at all. And here once the person gets the infection, throughout the life he has to suffer from the diseases. Rest of the diseases, if they are all identified at an earlier stage and if they take treatment timely, there is a 100% cure for all the diseases. Is one thing. Then the common symptoms. What are all the common symptoms? And common symptoms, it includes itching sensation, thereafter here fluid discharges and swelling of here the affected organs, slight pain at a affected organ. All these are the common symptoms for all the varieties of sexually transmitted diseases. If at all the diseases get ignored, if he doesn't take here the treatment at the initial days, then consequences of the disease, it leads to, see this point, a pelvic inflammatory disease. Simply we call it as a PID. It is a very important point here, pelvic inflammatory disease. So in this case, the total reproductive system of the female will be get infected. And here the external genitalia and vagina, cervix, uterus, fallopian tube, and even the ovary also will be getting here infected because of that. It leads to infertility in a woman. Thereafter it leads to abortions in a woman. Thereafter it leads to stillbirths. Here the mother gives birth to the dead baby, so lifeless baby is known as a stillbirth. Thereafter infertility, so here they will become unfit for giving birth to the young one. Thereafter here cancer of reproductive tract also will be taken place, ectopic pregnancies. Instead of implantation takes place in the uterus, then the implantation takes place in the fallopian tubes. Such a kind of pregnancy is known as ectopic pregnancies. Right. And here, and at last, here we need to conclude with an alarming sign. See this one. This is an important part. Right. The incidence of these STDs, sexually transmitted diseases or sexually transmitted infections, are too high in the person, those whose age is in between 15 to 24 years. The persons or the youngsters like you all, those who have got the age period in between the 15 to 24 years, and in this age group people only, most of them are getting infected by these pathogens, and they are all suffering from all the varieties of sexually transmitted diseases as of now we discussed. So that, my dear students, be aware about all these diseases and mode of transmission, and protect yourself from these kind of dangerous disorders. So that here, that helps you here in your life, and you will lead a healthy and happy life. So these are not only helpful for your examinations, even these kind of information that is useful to you in your day-to-day life. So hope you all enjoyed my lecture. Thank you all.